Taking metformin every day might seem completely normal, especially if you've been prescribed it for diabetes. But have you ever stopped and asked yourself, what is really happening inside your body when you take this medicine? Most people don't think about it, and they just take the pill and move on with their day. But the truth is, this small tablet goes through a complex journey inside your body. And understanding that journey can actually help you use it more safely. Metformin is mainly used to control blood sugar levels, especially in people with type 2 diabetes, when your body either produces too much glucose or cannot use insulin properly. Your blood sugar levels start rising. And that's where metformin steps in. Now here's something interesting. Metformin does not work in just one place. It actually works in multiple parts of your body at the same time. First, your liver. Your liver naturally produces glucose, even when you are not eating anything. But in people with diabetes, this production can become too high. Metformin slows this process down and tells your liver to stop releasing extra sugar. Second, your intestines. After you eat food, your body breaks it down into glucose. This glucose is then absorbed into your bloodstream. But metformin slows down this absorption. So instead of a sudden spike in blood sugar, your levels rise more gradually. Third, your body's cells. Metformin improves insulin sensitivity, which means your cells respond better to insulin and use glucose more efficiently. Now let's talk about what happens after you swallow the pill. When you take metformin, and it does not fully dissolve in your stomach. Instead, it passes into your small intestine. This is where most of the absorption happens. But here's the important part. Only about half of the medicine is actually absorbed. The rest of it moves through your digestive system when it is eventually removed from your body. This is also the reason why many people experience stomach-related side effects. Now you might be wondering, how long does it take to start working? Metformin usually begins to work within a few hours, but its full effect builds over time. That's why it is not a quick-fix medicine. It is designed for long-term use. Some people also notice weight loss while taking metformin, but this does not happen directly. It works indirectly by improving insulin levels and reducing fat storage. But remember, metformin is not a weight loss drug. Now let's talk about when you should take it. The best time to take metformin is with food or right after a meal. Taking it on an empty stomach can increase the chances of side effects like nausea or stomach discomfort. And this is one of the most common mistakes people make. Another mistake is taking more than the recommended dose, thinking it will work faster. But that can actually be dangerous. Now let's talk about who should avoid metformin. People with severe kidney problems should not take this medication because the drug is removed from the body through the kidneys. If the kidneys are not functioning properly, the medicine can build up in the body. Heavy alcohol consumption, is another risk factor because it increases the chances of a serious condition called lactic acidosis. Now, this is rare, but it is very serious. In this condition, lactic acid builds up in the body. Symptoms may include 1. Extreme weakness, 2. Difficulty breathing, and unusual tiredness if not treated in time. It can become life-threatening. Common off-label/secondary uses: polycystic ovary syndrome, PCOS, used to improve ovulation, regulate menstruation, and lower elevated androgen levels. Gestational diabetes, occasionally used to manage high blood sugar during pregnancy. Weight gain management, used to counteract weight gain caused by antipsychotic medications, diabetes, and pregnancy. A total review of metformin use during pregnancy compared to insulin alone found good short-term safety for both the mother and baby, but safety in the longer term is unclear. Several observational studies and randomized controlled trials found metformin to be as effective and safe as insulin for the management of gestational diabetes, polycystic ovary syndrome. The United Kingdom's National Institute for Health and Clinical Excellence recommended in 2004 that women with PCOS and a body mass index above be given metformin for anovulation and infertility when other therapies fail to produce results. UK and international clinical practice guidelines do not recommend metformin as a first-line treatment, or do not recommend it at all, except for women with glucose intolerance. Common side effects, and these include 1. Nausea, 2. Diarrhea, 3. Stomach discomfort, and sometimes a metallic taste. These side effects usually happen in the beginning and improve as your body adjusts. Finally, how long should you take metformin? This is not a short-term medicine. It is usually taken for months or even years, depending on your condition. So the most important thing to remember is metformin can be very effective, but only when used correctly. Stay informed. Stay safe. Always follow your doctor's advice. Never self-medicate, and never ignore unusual symptoms, because understanding your medication is the first step towards protecting your health.